Hello, my name is Dr. Jones DC, and thank you for taking the time so much for watching this video. I know you're super excited to try the red light therapy body contouring, and let me tell you, this is a very powerful treatment option that is helping people all across the world not only actually help mobilize the fat, but just improve overall health. But what makes this so special at Colorado Medical Solutions is what we pair the red light therapy with. Guys, sustainable weight loss, I think, is probably what most of you guys are looking to accomplish along with your body contouring. And let me tell you, the literature is very clear that it is difficult for most people to achieve real sustainable weight loss. And so you are about to embark on your journey of red light therapy, but what we do is we pair it strategically with some powerful lifestyle fasting called the Flow Protocol. This has been my life's work, and I help patients even without red light therapy all across the globe obtain real successful weight loss. And doing this with red light therapy, guys, it's like supercharging it, and the results are freaking out of this world. And at the end of the day, we're gonna back it up with our guarantee, guys. That's right, we guarantee results. That is, if you don't lose 1% of your body weight every single week, we will continue to coach you at no extra charge. And the guarantee doesn't stop there, because we are so confident in our protocol that we will continue to coach you, say, years later. If you begin to regain weight, no problem at all. We pop you back into the coaching and we get you back to baseline, because we are that confident with the Flow Protocol, especially when you supercharge it with this fasting protocol. Okay. So what we're gonna talk about today in this brief intro is red light therapy, the science of obesity. We're gonna get into the mechanics of the Flow Protocol, how our coaching works, and then putting it all together, guys. And remember, this is the intro webinar. So afterwards, you also have access to part 1, part 2, part 3, where we take a much deeper dive into how we got this overweight, the science of obesity specifically, and then expanded on the treatment options. This webinar is all about just giving you a taste of what it is, and then you decide where you want to go from there. Red light therapy. How does it work? Well, medically speaking, what we're talking about is photobiomodulation, and I know that's a big fancy word, but if you think this and you trace this back, we've known for over a millennia that the sun has some powerful effect. Many cultures praise and worship the sun because we know we feel better. And actually, in areas where there's less sun, we see lower levels of health. And so we know that the sun does something for our health, and science has really figured it out. Specifically within the spectrum of the light, there is this type of light that we call red light therapy, which consists of infrared and near infrared light. It's those wavelengths, because those different styles of light have different measurable wavelengths. It's the wavelength that produces infrared and near infrared light that we know produces these amazing benefits. And specifically, what photobiomodulation is referring to is the effects on the mitochondria. The mitochondria are like the powerhouses, the batteries of our cell, responsible for the production of all the usable energy that we need. Very, very important. And what red light therapy does is it improves on, it stimulates and causes the mitochondria to work more efficiently, to work better. And the translation in your fat cells is literally mobilizing the body fat. And that is so crucial, because at the beginning of every weight loss program, and one of the many barriers is the inability for a person's body to mobilize the body fat. We call that a low level of metabolic flexibility. And when you watch my Science of Obesity webinar, you're gonna have a much deeper understanding of what metabolic flexibility is. But this is why you might have skipped a meal or inadvertently fasted and struggled so much, because your body wasn't flexible enough, it couldn't burn the body fat. And so what red light therapy does for us is literally mobilize the body fat, which is why fasting is such an integral component for your success, because we literally mobilize it and then we don't eat, so we burn it. And so what I like to call red light therapy is artificially induced metabolic flexibility, which is gonna pair very nicely into the Flow Protocol, which we're about to talk about shortly. All right, so the science of obesity. You watching this webinar, this ain't your first rodeo, right? You've tried losing weight multiple times in the past and most likely tried counting calories, increased your exercise, reduced your caloric intake, and you probably lost some weight. But how much you lost was determined by genetics, 5, 10, 20, 30 pounds, but you hit a roadblock. You hit this plateau and probably gained a lot of it back, most of it back within months to maybe a year or two. There's a reason why this happens. It has to do with the insulin theory of obesity. This counting calorie method doesn't work, and some of the long-term data is actually very clear. There's some step trials done, and what they showed was the same thing. Some initial weight loss followed by this inevitable regain of weight. The reason why that happens is because the body has what's called a set point, and that set point is kind of like the thermostat of your house. Regardless of what else goes on, that thermostat is going to regulate and keep a temperature that you set the thermostat to. Well, your internal thermostat has a weight that it's trying to maintain. And so when you embark on a weight loss journey and you reduce your calories and you increase your exercise, you create this caloric deficit. That's like putting a portable AC unit by you because you want to cool off. The thermostat's set to 70 degrees and you get some initial drop in temperature, but then over time that thermostat overrides that AC unit and now the temperature is going to go back to 70 despite the presence of that little portable AC unit being on, which is that plateau. In translation, your body responds to the weight loss, that caloric deficit over time, by decreasing your metabolic rate and increasing your hunger. It's a horrible place to be at because you're working really hard to maintain weight and you can't eat as much. So we gotta get in front of that, and the only way to dial down that thermostat is to lower insulin. You can't lose body fat in the presence of elevated insulin, despite being in a caloric deficit at that time, which is why the body ends up downregulating the metabolism in response to a caloric deficit and elevated insulin levels. And so we gotta lower those insulin levels, but it's very difficult when you have a condition called insulin resistance, which in essence is a condition where your body is no longer responding to insulin as well, and your body has to respond to insulin because insulin is what takes the sugar out of your blood and puts it into your cells. If it didn't work, you would die, because we know high blood sugar is a condition called diabetes. And so when you are resistant, your body has to produce more and more insulin. So we gotta get in control of the insulin resistance in order to get ahead of our weight and lose it much more easy than we ever did before. Okay, the flow protocol. This is, again, the most aggressive approach towards prolonged fasting. I created structure where structure was missing. I like to think of it as a little bit of science meeting ancestral wisdom. So in essence, what it is a weekly long fast, a weekly prolonged fast. 48 hours seems to be this magical number that I really like with patients. I can go up to 72, I can go as low as 36, and there's a lot of variations of it that we take patient by patient. But in essence, it is a weekly long fast. And so why does it work? I can talk for hours about why does it work, but there's 3 main changes to your physiology. We have insulin resistance, inflammation, and metabolic flexibility. We'll take a much deeper dive into those topics in part 2, the science of obesity. But insulin resistance, we just talked about it. So these long periods of fasting does wonders for healing the insulin resistance, because those receptors became resistant to insulin to begin with because it was always elevated. And so the most powerful way to lower insulin is to not eat. And the longest period of not eating is, sounds silly, but not eating over a long period of time, prolonged fasting, right? And doing it repetitively is the most powerful version of that, AKA the flow protocol. Now, inflammation is also reduced by these long periods of fasting. And inflammation, it drives this inability to mobilize fat, kind of similar in its own pathways to what insulin does. It makes it harder for your body to mobilize the body fat and burn it. And so this magical process called cellular autophagy, which is a healing process that the body does in response to these periods of fasting, does wonders for lowering inflammation. And then finally, metabolic flexibility, which is your body's ability to not only burn carbohydrates, which is what it's always doing. Everybody is a good carb burner, but most of us are a poor fat burner. because we never put the body into a situation where it has to rely on fat because we're not exercising, we're eating too much and we're eating too often. Okay, now I know you might be thinking 48 hours every single week, you are out of your mind. I can't even go, I can't even skip breakfast, right? Well, don't worry, we have ways to make this easier. We have supplements that accomplish just that. They are powerful appetite suppressing supplements. It's been a lot of work that I've done into researching these supplements. So you'll have access to order those supplements and we'll coach you because there's many different versions and different amounts and different combinations. And we'll find the combination for you that makes it easier for you to get into the flow fasting. Okay, so let's talk about coaching because this is how we're going to implement the program for you. You start off with an intro Zoom call. I keep those capped at 5 people. It's kind of nice because you get to see that you're starting your journey. You're not alone in this. We have a community of folks just like you. And so that is your customization call. Now we will send you the protocol with just the amount of information you need to get started and with just the videos you need to get started. So you have to watch that. Then we do our intro coaching call where we can customize this and tailor it towards you. Then we move you over to the group format of coaching. This is every single week I do a live Q&A. About a week before the trainings, we have a post where you can submit all your desired questions. Then the day before the training, you get the agenda so you know exactly what's going to be on that training. Every single training is fully recorded and accessible on the private group. And then what I love most about this is because some of our patients want to catch everything, they're on every live. Some people want to catch everything, but they can't because they're busy, so they catch the recordings. And then we have our really busy patients that only want to see the questions that they asked. And so we have Flow University, which is everything on a teachable account in a table of contents, nice and beautifully ordered so you can go right to the topics you want to get. So the opportunity to be able to participate, get your question answered in a much more economical program because it's done in a group setting is very high. We have a Flow hotline. So in addition to being able to ask whatever questions you want and have it delivered to you in that group training, we have a dedicated Flow hotline where you can text to communicate to us and ask any questions, any difficulties, any issues. Because we do put a guarantee of results, the most important thing for you to send to us would be a text message explaining that your weight's not budging so that we can get on a personal call and get that fixed. The accountability system is very high. We have a program where you submit your weekly weigh-ins and then our team is tracking that for you so that we can reach out to you if there's any issues, or if you reach out to us that you're not losing weight, we can sit there and look at your results week by week by week. And this is the format where we've really created this high level of success for you guys to be able to implement the Flow protocol and get the results that you've been wanting for so long. Okay, so let's put it all together, guys. You are here and you're trying to get to your goal, 50 pounds, 20 pounds, 100 pounds. You've done it before, you've done half of it, you've done a quarter of it, but you've always gained it back, right? So in order to get you there, that's the Flow protocol. So think of this program, you're like a kid jumping on this metaphorical bike, taking you to the end goal, which is this journey. Our coaching system, this program is like the training wheels for that journey. We're gonna help get you there. But then when you're done, when your insulin sensitivity is high, when you're very metabolically flexible and your inflammation's under control, you will be able to maintain this weight and live the Flow lifestyle. The Flow lifestyle is this is our community that we've also created of patients who have implemented the Flow protocol, gotten their results, and now they're maintaining their weight with much more ease. Essentially, what this is a lifestyle of long fasting. Instead of every week, they're doing it every couple weeks. And we have a different group for them. And I get on there and I give them an update and check in on them once or twice a month. That's pretty awesome. So that's it for the intro webinar. Please, if you watch this and you've tuned in to this point, then go ahead and do yourself a favor and watch part 1, 2, and 3 so that you can get a much deeper and more comprehensive understanding of why this program is so wildly successful. And do that before your first call so that you have a better understanding, you know what questions to ask. And I look forward to working with you guys to obtain higher levels of health. We'll see you later.